This summer, I had the opportunity to go to my first NASCAR race. To be honest, I wasn't quite sure what to expect, other than making the assumption it was going to be very loud. I decided I wanted to get there early. This one's not working. There we go. I decided I wanted to get there early so I could take in the entire experience, even upgrading my ticket to the fan zone so I had access to the garage and the track so I could see firsthand the amount of prep work even before the race began. As I walked around and I watched the teams prepare their cars, I was impressed at the attention to detail, the deliberate checks and balances, the perfectly organized toolboxes, and the assigned roles each member had, all at the clear direction of the crew chief. It didn't take long to realize at any point throughout this preparation there was a failure, it could mean a catastrophic outcome. High-performance teams working in a high-stakes environment. This translated personally to me as one of the key functions within my program is to evaluate high-performance teams working in a high-stakes environment. And just as if there's a failure on the racetrack, when there are failures in the healthcare system, it too can mean a catastrophic outcome. This year, approximately 290,000 hospitalized patients will suffer a cardiac arrest. And despite advances in resuscitation healthcare and training, only about 20% of those patients will survive. Just let that sink in for a moment. I think we can all agree that those statistics are just not good enough. So what if we took a step back from focusing only on the performance to evaluate the bigger picture? If you've ever worked in an acute patient care setting, more than likely you have participated in a remote event where we can simulate a cardiac or respiratory arrest using a mid-fidelity mannequin. There are several ways to train and practice these critical events, even borrowing concepts used by the pit crew, where they run through the event over and over again, building muscle memory through deliberate practice until the performance is acceptable. The week prior to going to the race, my team happened to be at a local VA medical center, doing an assessment that focused on their medical emergency care process. We utilize a simulation-based strategy to identify potential failures. This assessment allows us to take that step back, to not only focus on the performance of the team, but to identify what barriers and failures exist that limit that team's ability to perform in that moment at its. Have you ever witnessed the pit crew team taking care of their car as it comes in for a pit stop? They're known for their controlled organization, what some may see as a finely tuned, well-oiled choreographed response. The team depends on each person's successful and timely execution of their job to ensure that that race car is fully operational and back on the track within the fewest number of seconds possible. Now let's imagine you're in the hospital and you hear that faint click of the PA sound and followed by an announcement of code blue. The wording may differ from hospital to hospital, but the meaning is exactly the same. Somewhere, someone is dying. We hope that help is on the way, that the operator activated the code team and that code team knows where to go. If the communication isn't clear and concise, we see our first set of failure points. The team arrives. The area is crowded, making it almost impossible to get to that patient. Who's in charge? Who's doing what? Where's my equipment? Do I have the right people who know how to use the equipment? As an organization, we pride ourselves in providing our employees with the right tools and resources to be prepared for this very moment. But when there are gaps, we see yet another set of failure points. System failures and inefficiencies exist in every organization, often emerging organizations have delays. Throughout this assessment, we often find that failures fall into general themes to include communication, the environment, that we put into place within our own system. Walking around the racetrack this past, I found myself searching for potential failures and realized the commonality between these very themes. The race itself is just like my code. But what happens before and after that race might be the very thing that sets it up for success. By using simulation as a framework focused on high reliability, we allow our healthcare teams to function in an environment that is as close as possible to a real clinical situation. Over the course of our assessment, our team works with key stakeholders, internal policies, and past performances, looking for gaps and potential failures. During facilitated discussions, we process map the current state and utilize a SWOT analysis to identify low-volume, high-risk vulnerabilities. Throughout our Gemba walk and our simulation events, we record observations using a risk analysis tool. Step by step allows us to prioritize strategies to drive improvement, improve patient safety, and veteran outcomes. Thank you for your time.